So hello, everyone, and welcome to the student information session for the UC Berkeley UCSF Joint PhD program in Computational Precision Health. We are so happy to see you all today. Thank you so much for joining us. We will be giving a 45-minute presentation, followed by questions from you at the end. And you can always type in your questions into the Q&A section of the webinar throughout the presentation if you have any. And we will be recording this session for those who are not able to attend. Okay, so let's get started. Next slide, please. Bianca. Yeah. So here's our agenda for today. So first, we are going to tell you a little bit about the vision of the CPH program and the research topics that fall under the Computational Precision Health umbrella. We will then give you an overview of our bi-campus PhD program. We will talk about the admission process and our PhD curriculum. And then we will talk about our commitment to specific initiatives around diversity. We will then give you a glimpse of the experiences of some of our current PhD students, followed by a quick overview of some of the research done by our faculty. And then finally, we will take questions. And again, feel free to type in any questions you have in the Q&A during the presentation. Next slide, please. So my name is Ahmed, and I'm an assistant professor at CPH. I work on machine learning and causal inference for healthcare. I'll be co-presenting today with Irene Chen. Irene, would you like to say a quick hello? Also, we can do a mic check.
Yeah, perfect. Hi, everyone. My name is Irene Chen. Along with Ahmed, we will be leading the webinar today. My research focuses on machine learning, algorithmic bias, and health equity.
Awesome. Next slide, please. Okay, so our co-directors are Maya Peterson and Ida Sim. They are sending you their warm regards. They would have loved to join us today, but unfortunately, they couldn't make it. Ida is a professor of medicine at UCSF, and Maya is a professor of biostatistics at UC Berkeley, and they both co-lead the CPH program, which really speaks to the multidisciplinary nature of this program. Next slide, please. Okay, so CPH is a very young program. It was founded just 2 or 3 years ago and was really motivated by our realization that the promise of AI and other computational methods is still far from being fully realized in healthcare. So while we have witnessed remarkable advances in areas like data science, big data, machine learning, and AI, which, as you all know, transformed various industries and has impacted our daily lives in many ways, the same level of transformation hasn't yet reached healthcare to the extent that we expect or the extent that we like. In fact, as Ida would tell you, many clinicians today are still delivering care in ways that are surprisingly similar to practices from the 1980s, specifically when it comes to incorporating data and computational tools into patient care. Next slide, please. So we truly believe that in order to transform personal and public health through computation, we need 2 things. First, we need to create a new discipline at the intersection of computational and health sciences that's focused on making a real-world impact. And second, we need to create a new environment where clinicians and computational researchers can collaborate closely, and where computational researchers can get familiar with real-world problems in clinical settings and ensure that the solutions that they develop can actually be deployed and applied within health settings. So this is really what the CPH program is all about, and we hope that you, as the next generation of leaders, will turn this vision into reality. So with that, I will hand it over to Irene, who will share some details about the scope of the research happening at CPH.
Fantastic. So what is computation precision health? Some of you may be confused because there aren't many other programs like this out there in the entire country and perhaps the entire world. We think of computation precision health as a new discipline, something that combines a lot of the things that you might be familiar with. The fact that we have copious amounts of health data, copious types of health data, as well as these advancing computational methods. So things like machine learning, informatics, data science, all of these come together in order to target the people who would be precisely affected, who should be affected by these advanced methods and these new data sets that are available. So when we think about the populations who will be affected, we think of the clinic, we think of the hospital, we think of community workers, we think of the actual patient population. And so the focus of computation precision health then is to make sure that we are both improving health, so just thinking about better disease prevention, earlier detection, more effective treatments, as well as health care. And so the difference here is a little subtle in that here we want to also make sure we are helping our healthcare professionals. We are making sure that we're doing decision support, we're tailoring patient-facing communications, and we're optimizing our care processes. Next slide, please. The 3 CPH pillars can be thought of as we want to focus on the complex whole person care, which means that we don't just treat one disease, we don't just give you a medication and then you walk back out the door, but we're really taking into account the entire person, which is helped by the massive amounts of health data that we now have available. We also want to what we call augment intelligence. So this machine learning computational methods do not exist in a vacuum. They come from an already robust structure of healthcare that exists today. So as one bullet point points out, the computer isn't the smartest doc in the room, but it helps every clinician to be better every day. And then lastly, it's incredibly important that we don't keep our findings just to the hospital. And in fact, a lot of health happens outside of the hospital walls, especially as resources become more and more strained. So our goal is to bridge the inpatient and the outpatient, the clinical and the public health. Next slide, please. So what is this, when we think about the computation precision health paradigm, we want to target a world where we have what we call adaptive precision interventions. We aim to use computational breakthroughs then to formulate precision problems, to develop precision solutions, and deploy those solutions more effectively. And the goal here is to have a broad impact on real lives. Computational advances, they're very fun, they're very interesting, but they don't mean anything if they're not deployed in real world settings. And they can, you have to grapple with then all of the real complexities of the technical nuance, the economic impacts, the operational considerations, as well as the social factors. Next slide. Next slide, please. Great. So the Computation Precision Health program spans 2 campuses, UCSF, and later we'll talk about UC Berkeley. So why UCSF? Many of you are familiar with the fact that UCSF is a top medical university, medical hospital, but some of you may not know that that UCSF created the first electronic health record in the 1970s. Today, we've come a long way since the very first electronic health record, and in fact have, I would call one of the crown jewels of the UCSF data warehouse program, which is the information commons. So this is electronic health record data that spans over approximately 4 million UCSF patients, and in fact does date back to the 1980s, although truthfully it ends up being like a few patients each year in the 80s, and then obviously in the last 10 or 15 years has really blossomed as we have all of the de-identified notes. We have radiology imaging, genomics data, all cleaned and ready for computation for access for anyone in the Computation Precision Health program. Additionally, we have the UC Health Data Warehouse, which is for all 5 UC medical campuses, so not just UCSF. But fundamentally, UCSF Health is a place to field and evaluate machine learning and computational methods within an established system that is already practicing advanced world-class healthcare. So I cannot emphasize how rare this is when you look across different healthcare systems to have computationally advanced expertise paired with where the healthcare really happens, and a leadership that is very excited to engage with computation precision health and deploy the tools that we develop here. Next slide, please. And then what about UC Berkeley? So across the bay, we have another university, UC Berkeley, which, as some of you may know, brings world-class expertise in other fields, for example, computing, statistics, data science. These programs are consistently rated top in the US, as well as other disciplines that are not purely computational. Think public health, industrial engineering, electrical engineering, even economics or business. Health problems are fundamentally interdisciplinary problems, and we are quite fortunate to sit almost at a locus between all of these different disciplines, both at the Berkeley side and as well as the UCSF side. So Berkeley, and specifically, I would say, brings this breadth and depth of disciplines for a campus that spans both the humanities, the sciences, and engineering. And the third point I want to emphasize here is that this right now is incredibly exciting time. There is a new College of Computing, Data Science, and Society, which is the sort of new brainchild coming from years and years of demand at Berkeley for more interdisciplinary work. The associate provost, Jennifer Chase, joined Berkeley from Microsoft Research in order to head this new division. And even before joining Berkeley, Professor Chase had a long vision of the potential and missed opportunity at this intersection of computation health. Wouldn't it be great if we could just get everyone, not just in the same room together, but in the same department, in the same structures, to be able to communicate and have really tight collaboration? And so Professor Chase has played a key leadership role in computation precision health since its inception. The College of Computing, Data Science, and Society is actually now the first new college in 50 years in Berkeley, which is proof of how central this is to Berkeley's future, and how important everyone from the administration all the way down to the students find this endeavor. So computation precision health is a big part of CDSS, and we look forward to sort of leading the charge here. Next slide. All right, and now Ahmed is going to tell you a little bit about what the actual PhD program will look like.
Okay, so now that you have a better understanding of the research landscape at CPH, we will walk you through the admission process and our PhD curriculum. So the first thing we would like to emphasize is that if you join our program, you will be a PhD student on both campuses, which means you can take classes on both campuses, you can be advised by faculty from both campuses, and you will graduate with a degree in computational precision health from both UC Berkeley and UCSF. And in terms of admissions, we are really an interdisciplinary program. So we are looking to train the next generation of talent that brings expertise and fluency across very different fields, including computer science, statistics, medicine, and health sciences. And of course, we don't expect you to be an expert in all of those fields coming into the PhD program, but we expect you to have interest or prior exposure to maybe 2 or more of these fields through your previous research or previous job or previous internships. We are also very interested in students who come from non-traditional backgrounds, who are really excited about starting something new and growing this new discipline into its full potential. And later we will show you the backgrounds of some of the students we have admitted last year. Next slide, please. So what are we looking for in an application? So this is very much a holistic admission process. So we are looking at the full picture of who you are and what you would bring to this program through your research. And we are particularly looking for evidence for intellectual and research independence. So this is something that should be reflected in your application packet. Your application packet should include the following items. So we would ask for a statement of purpose and objectives, a personal history statement, letters of recommendation, in addition to your academic transcripts. And what we will be looking for in an application is not only a strong academic background and grades, but very importantly, we want you to show us that you have thought about why you want to do a PhD and why you think your research interests are aligned with this program, and also why your research interests are aligned with the research vision that we have just described in the previous slides. In terms of recommendation letters, please make sure to find recommenders who know you personally and who can really speak to your personal qualities and your academic initiative, your independence, your potential to grow into a leader in this field in the future. Okay. Next slide, please. So now let's talk about funding and how funding works in our program. So we provide a very competitive annual stipend of around 45K, and that is a commitment over 5 years, which is the normative time to degree. This funding also includes full support for tuition and fees, and for international students, this also includes a supplemental non-resident tuition fees. We wanted to stress that we accept international students, so the same funding scheme, funding rules apply for both domestic and international students. And because we know that the application fee may be a barrier for some of you applying, if you are a US citizen or a permanent resident, you can apply for an application fee waiver through this link. We also encourage you to reach out to Bianca Victorica if you have any further questions on the application process or the application fee waiver process. Next slide, please. Which is a great segue to introduce our wonderful graduate students affairs officer, Bianca Victorica, who I'm sure many of you already know, and you may have exchanged emails with her previously. So Bianca is an incredible resource for you for all sorts of questions that you might have on the program. So you can email her if you have any questions using this email address. She also supports graduate students who end up joining our program. So she might provide insight into what your PhD process might look like. Bianca, do you want to say a quick hi?
Hello, everyone. Thank you for being here. I do want to just kind of go back and just have everyone visit our admissions page on the website, because now CPH also does have a limited number of application fee waivers for international students. So some good news there.
That's great news. Okay, so the deadline for applying to our program is December 3rd. Please keep in mind that it takes time to put together a strong application and collect letters of recommendation and all of that. So please don't wait until last minute to apply. And we're really looking forward to reviewing your applications. Next slide, please. So now a bit about the curriculum and what you are going to study if you join our program. So as a bi-campus interdisciplinary program, our educational guiding principle is really for you to learn by tackling real-world problems in multidisciplinary teams. And because our focus is very broad and very multidisciplinary, our curriculum is also very flexible. The basic outline for the CPH curriculum is that you will go through 2 years of coursework that are both at UC Berkeley and UCSF. And this will be followed by 3 years of dissertation research. And of course, many students also start the research earlier. The courses that we offer include a cornerstone course in which you will study state-of-the-art machine learning and AI methods to tackle real-world problems in healthcare using UCSF data. And that's a project-based, very hands-on course. We also offer a practicum, which will provide you with an in-depth exposure to the UCSF health system, including shadowing clinicians during their practice. We also offer a doctoral seminar and research rotations during your first year, which are really meant to just let you interact and work with researchers from different labs so that you figure out your advisor and your home lab. And of course, being on both campuses, the UC Berkeley and UCSF campus, you are in a position that you can take courses from other departments as well. So you can take computer science courses, statistics courses, whenever that's appropriate and fits your research goals. And now I hand it over to Irene to talk about CPH's commitment to diversity, equity, and inclusion.
Fantastic. So thank you, Ahmed. Let's go to the next slide. Diversity, equity, inclusion, and belonging is core to computation precision health. So we believe that as we develop these computational advances for healthcare, that they should benefit all people. And particularly as we train the next generation of researchers to tackle these problems, we believe that it's incredibly important then that we prioritize diversity, equity, inclusion, and belonging in 3 core areas, mainly research, teaching, and service. And the reason we're really serious about this is that a range of perspectives and backgrounds can have a huge impact on making our work stronger. So not only do we acknowledge that we're not perfect, we're still making progress for that, but it's incredibly important that we're committed to working towards these goals to improve opportunities for all. Can you go to the next slide? So what does that look like at Computation Precision Health? So functionally, we have a faculty equity advisor, that's me. And we also, within the Computation Precision Health PhD program, we have a paid diversity student fellow who receives a stipend every year. And the reason that we have that, oh, can you go back? Sorry, great. And then the reason that we have sort of both the faculty perspective and the student perspective is because diversity, equity, inclusion, and belonging funnel into many different aspects in the computational precision health program. So on the one hand, we have a high emphasis within the curriculum, within the cornerstone class that Ahmed just mentioned, as well as a dedicated practicum for public health, focusing on underserved communities. We want to make sure that our students, as they go through the program, have a key understanding of the systemic issues that health equity face, as well as any potential complications that computational methods run into as they start to look at some of this data and try to have impact on these communities. In our admissions process, we want to emphasize that the admissions process is holistic. We understand that people come from different backgrounds, they have some coursework, but not necessarily everything. And we are committed to looking at the entire person as we go through the admissions process, and then later the mentoring and advising process as well. Some of you have a background in graduate research, other people don't. We don't want to assume you know what the steps are and what it means, and you won't have to guess. We want to make sure that it's very explicit, that we're all on the same playing field, that we're all having an open conversation about what we find easy, what we find difficult about the PhD program. Of course, though, things can change. People have all kinds of feelings and thoughts on their inside that they might be hesitant to share in a one-on-one setting. And as a result, we are really committed to having climate surveys and focus groups, sort of taking the temperature of what's going on, seeing what is happening, what's working well within our smaller program, but also on the larger campus, on both campuses, UC Berkeley and UCSF. And then lastly, the faculty recruitment. So as part of the faculty hiring process, there is a diversity, equity, and inclusion statement. But even more than that, we're committed to our faculty and staff representing and also being trained to address questions of race, LGBTQ identities, as well as specific initiatives in place for additional faculty hiring. So there's lots of ongoing work. There's no specific goal that will say, we've done it, we've achieved diversity, but I hope that this is making it clear that diversity is a necessary and critical part of ensuring equity in the CPH program. Next slide, please. I'm also going to cover the student experience. So the student population currently includes 15 PhD students and 19 designated emphasis students. Designated emphasis is perhaps an unfamiliar term to some people, but it's essentially PhD students in other programs who have expressed an interest in computation precision health and now take classes with us and attend events. So you can think of it a little bit like a minor. We anticipate building a cohort for the 2025 academic year of about 6 to 8 PhD students. Next slide, please. We are, so of our 2024 cohort, maybe this is very relevant to everyone who's on the webinar, I would say we have a wide range of backgrounds, both geographic, but also in area. And as you can sort of skim through here, we want to emphasize that there is an emphasis on making sure we have representation across our matriculating class, a range of trainings and backgrounds and majors, but of course, much work and continual work to be done across many different dimensions. To offer some statistics that might be helpful, in 2023, the first year of our PhD program, we had 209 applicants and we admitted 12, and ultimately 7 accepted with 1 deferral. So that's about a 5.7% admit rate. In 2024, so this cohort right here, we had 283 applicants. We admitted 10, 9 accepted. So that's about a 3.5% admit rate, 90% yield. We have a wide range of international students, California residents, or other residents, citizens/permanent residents. As the years go on, as we become a more established program, as we sort of have a wider reach in terms of who is applying to our program, the pool is getting more competitive. The pool is getting deeper. Every year I read through the applications and I think, wow, these people are just all stars all around from all kinds of backgrounds and all kinds of experiences. So we currently have 3 students coming in with fellowships, which is helpful. And then as well as the intention amongst the current faculty and financial support level, as I mentioned, is to admit 6 to 8 students this year. Next slide, please. But don't take our word for it. We asked our PhD students and our designated emphasis students what they were most excited about for computation precision health. So here, Xingyan Han has a nice blurb about how we're at this pivotal moment in the healthcare systems of AI, as I mentioned, as well as being part of a supportive and professional community. And so that's something that we really strive to make sure that we're reaching students and supporting them professionally, as well as helping them through what could be a quite arduous process of completing a PhD. Amongst our designated emphasis students, Eduardo and Nikita, we see that Eduardo is very excited about like-minded faculty and students. So even though he's in a different program, he's quite excited about the CPH program because of the impact, the human-centered approach to improving healthcare delivery. And then Nikita at the bottom emphasizes the interdisciplinary community. So the people who are working on both computation models as well as healthcare. Next slide. One question in meeting with a lot of students that comes up, or prospective students people who are thinking of applying to the CPH program is, well, What happens after the PhD program? Where do the graduates go? What is the, where could I expect to do after receiving this PhD? It's a great question, and it makes total sense that people are curious and perhaps eager for more information here. We anticipate that our graduates will go to a wide range of different sectors. So both academia, pursuing faculty positions, pursuing data research scientist positions at different medical centers. We anticipate that health and public nonprofit sectors will also be of interest, particularly in the public policy side, as well as going to where health care systems are actually developed and being in-house as a computational specialist. And then lastly, we are in the Bay Area. We have, you know, tech companies. You throw a rock and you hit a startup. You throw a bigger rock and you hit a bigger tech company. And so it's quite likely, and we fully expect that many of our graduates will also be interested in big tech companies, pharma and life science industry, or perhaps startups, or some combination of all of these factors, or something we can't even anticipate in ourselves. And I want to emphasize that Computational Precision Health as a program is also committed to providing resources to opening up our AGG groups, so our professors who are affiliated, opening up our networks and helping our students get placed well in industry internships, research internships, or starting to map out what happens after this PhD. And can we think about that not just as you're graduating, but a few years before as well? Next slide. And now Ahmed is going to take it over about discussing the faculty research.
Yeah, so now, thanks, Irene. So now we're going to give you just a brief overview of our faculty and how the CPH program is situated in the broader UC Berkeley, UCSF campus structure. So we do currently have a large graduate group of 68 faculty, and you see that they come from a very wide range of divisions and departments from both UCSF and UC Berkeley. So we have faculty from all different performance sites at UCSF. UCSF has multiple hospitals, and UCSF faculty come from all of these sites, including the Zuckerberg San Francisco General Hospital, which is a public hospital. On the Berkeley side, you can see the range of departments and schools that we are drawing from. It's very broad, ranging from the Haas School of Business to the School of Public Health. We also do have a very deep partnership with the electrical engineering and computer science departments. In fact, I think all the faculty on this call are also affiliated with the CS department, as well as the statistics department. We currently have 5 primary faculty who are directly hired into CPH and are faculty members of both UC Berkeley and UCSF campuses. And as Irene said, we have 15 CPH PhD students who joined us over the past 2 years. And also, as Irene said, we have this designated emphasis program in which students from other departments, both in UCSF and UC Berkeley, can do a minor in CPH. Okay, next slide, please. So all of the 5 primary faculty in this intersection of the Venn diagram are with us in this webinar today. They are going to give very brief presentations on their research, and in interest of time, I'll just let them introduce themselves. And again, I'll hand it back to Irene. We're going to start with Irene's overview.
Hi, everyone. All right, now I'll take off my webinar leading hat and put on my research hat. I lead the Computational Healthcare for Equity and Inclusion Lab. Coincidentally, it spells out my last name, so it's the Chen Lab. And we have 2 main goals. One of them is to develop machine learning methods to improve health equity. This can be quite broad, and right now we have areas including women's health, we have research including climate change, and we have areas thinking about how to make clinical practice more equitable as well. And the second aim that we focus on is thinking about algorithmic bias. So as we develop computational methods, we want to make sure that they improve healthcare for everyone. And in order to audit that and address it, we need more and more advanced computational tools and domain expertise to better understand that. So this year, I am looking to hire 1 or 2 PhD students. Hire is probably the wrong word, accept, support, advise. And particularly, I find that PhD students who thrive in my lab have a couple of key factors. One is that they have strong computational backgrounds. I think fundamentally we work at very intense, very advanced computational methods, and it would be nice if people had strong technical backgrounds. I enjoy working with students who are motivated and curious, who have a thirst for what's going on out there, thirst for understanding. And then third thing is that students from non-traditional and underrepresented backgrounds are especially encouraged to apply. I define that quite broadly. I have students in my lab who have transferred from community colleges. I have students who come from racial backgrounds or gender backgrounds or ethnic backgrounds that are non-traditional. And then I also have students who come from not computer science backgrounds or not math backgrounds and have sort of had circuitous routes. So I'm eager to talk to everyone from all kinds of walks of life. On the right-hand side, my training is in math. I was at Harvard for undergrad. My PhD is at MIT, so I'm an East Coast, born and raised, but then transplanted now to the West Coast, and I enjoy playing piano as well as long distance running. So next slide, please. As an evidence of sort of the breadth of the kinds of projects we're working on, we look at the entire machine learning pipeline, all the way from the beginning of what problems we're looking at. I mentioned women's health, I mentioned climate, health, AI, all the way to the very end as we develop these algorithms and deploy them. How do we make sure they're working? What parts of these pipelines went bad in order for the very end to be caught? All right, and then I'll pass it on to my colleague, Professor Adam Yalla.
Hi, everyone. Next slide, please. So my lab focuses on how can we do better in cancer as a computational problem. So the deeper you get into the world of cancer, the more frustrating it is how little we know. If you look at the way we do screening, you have a bunch of people who can't be screened at all. They get later stage disease than we would want. So it has really morbid pathways. If you look at the world of diagnosis, we end up doing much more severe pathways than we need, causing a lot of patient harm. And we try a lot of treatments that just don't work. And to kind of resolve each of these challenges, it kind of comes down to a single unifying challenge of how do you understand what's the right intervention for the right patient at the right time. And this is a very difficult problem. And because the stakes are so high, we have so much data that's there, we just need to be able to use it. So to give a motive example of some of our work that's most mature in screening, next slide, please. We're gonna zoom forward, we're gonna zoom into a breast cancer problem. Bianca, thank you. So in this context, we want to understand how do we actually catch cancer earlier. There's three component parts. One, we need to understand how we miss so many cases. How do we get foresight of where the disease will be? Given that kind of predictive power, what do we do about it? How do we create new kinds of health policies that we can roll out at scale to actually change the path of care to catch disease systematically earlier? And finally, next slide, please. We're also running trials. And even though mechanism how we run trials to develop that evidence to change the standard of care, the very way that we think about trials need to change. And we have some ongoing work with Ahmed, who might mention it later, and thinking of new ways to do adaptive trial design, given the fact that our AI tools can change. Next slide, please. To kind of summarize these pieces, my lab across many cancers, not just breast, we think a lot about these kind of three core themes. One, how do we better leverage everything that's there, the many gigabytes of data that's available to better understand outcomes that we care about, who's going to get cancer, who's going to respond to therapy, why and why not. Given this information, what do we do about it? How do we make new kinds of health policies, interventions, and place them to the right person at the right time? What does it tell us about new kinds of therapeutic targets? And then finally, how to take it to the last miles, translating these tools, running real trials across many centers, and changing the way we run trials itself, because our evidence generation isn't fast enough. Next slide, please. To close, I think it's really exciting. This is something I'm deeply, deeply passionate about. And so if folks want to work on this kind of thing and want to make a difference in the space, I really think this next PhD generation can see things from idea to helping real people. I think it's intractable methods today. And so the kinds of students I'm looking for are people with also quite solid computational backgrounds, because there's a lot of, I think, deeply impactful work to do that's going to require really sustained innovation. And with that, I'm going to pass the torch. Thank you.
Hi, so my name is Sandhya. I started in July, so I am kind of fresh to being faculty. So my background, as you can see on this slide, is highly interdisciplinary. I was originally trained in biomedical engineering and applied math and stats, and then I did a year in neuroscience, and then I did a PhD in medical engineering and medical physics at a similarly dual institution program on the other coast. And so my lab is highly interdisciplinary. The type of research I'm really interested in is I like wearing different hats every day. I'm also affiliated with a couple of other departments and programs, and I'm only 3 months in, so still working on expanding that as well. But in terms of, I'm looking for about 1 to 2 students this cycle, and particularly students who are interested in wanting to be interdisciplinary across this wide range of kind of fields. That can span from wearable sensors, statistical modeling, data science and machine learning, neuroscience, neurology. And fundamentally, in addition to building tools that help clinicians and patients make better decisions, something that really fundamentally motivates me is trying to help shed more light on what is actually happening in the body in disease. And so that's another aspect. When I talk to students, I'm looking for students who are also really interested in just diving into answering more questions about what is happening in the disease that we don't know yet. Next slide, please. So the main challenge or question that I'm really interested in addressing is why is healthcare right now so dependent on doctor-patient exchange? And what I mean by that is, if we think about most patients, they spend a very small fraction of their time in a clinical setting. And most of our lives, I mean, all of us are patients in the healthcare system at some point or another. We spend most of our lives outside of that. So, that's time spent sleeping, the things we eat, when we eat, other kind of physical, social interactions, right? All of that influences our health, but right now it's largely excluded from the healthcare system. And so a lot of what I do is try and figure out how we can better capture information that is useful to clinicians about all of these circumstances that are currently not in the healthcare system. So that includes what happens outside of a clinic. That includes what happens when patients cannot communicate for themselves, such as when they are under sedation or anesthesia. And that includes information that even if you have the most aware patient on the planet, they could not communicate this information because it is out of their conscious control. So those are kind of the areas that I am interested in. Next slide, please. So this is kind of hot off the press from the last 2 weeks or so, but this is an example of where I see that there's untapped potential for wearable monitoring in disease, specifically to help characterize individual variability and complexity in a lot of kind of chronic illnesses or situations where there is no one-size-fits-all solution. So in this case, I built models to track unconscious pain when people are under anesthesia and surgery, because obviously you cannot ask them how they're feeling, which is the standard of care for pain assessment. And so we used wearable sensors and tracked aspects of the nervous system to figure out, their unconscious pain response. Next slide. I think wearable monitoring is also highly scalable. So these are examples of some of the kind of prototypes or sensors that we use in various situations. We do a lot of at-home monitoring as well. So how do we send patients home with sensors and then make sense of that data and build tools to analyze that data? Next slide, please. And then obviously the end goal is impact. So to provide richer insight for clinicians and to maximize patient quality of life. So this figure is taken from a paper from last year where we did 24-hour at-home monitoring of patients who had a digestive illness called gastroparesis. And we were able to see for a single patient that before they had corrective surgery to after, you could see their actual recovery because we could see this kind of at-home circadian rhythm, how their stomach reacts after they eat meals, things that you can't capture in a clinical setting. Next slide. So I'll end here. So these are kind of the outstanding questions in the areas that I work in. You can see kind of the interdisciplinary nature of the types of questions I'm interested in. So it spans from engineering new wearable sensor systems to the machine learning and AI models we need to understand biosignals or signals that are generated by an actual physiological phenomenon or process. And then a wide array of opportunities in clinical medicine where clinicians would really benefit from having better individual characterizations of each person's underlying biology. And my lab is called SAND Lab, and you can see the website on the right. There's a QR code. And I'll stop there.
Next slide, please. Hi, everyone. Thanks so much for being here. My name is Serena. I'm an assistant professor. I'm joining in July of next year. but I will be recruiting students this cycle so that students would be showing up in fall 2025 when I show up. I recently graduated. I did my PhD in computer science at Stanford. And at Berkeley, I'll be joint appointed in CPH and in the EECS department in the CS division. Next slide, please. So my research is a little different from the others. I'm doing AI for public health, and a couple of themes, which I'll explain a little bit more, include looking at novel data sources, for example, from cell phones or from social media or search logs, and trying to infer health behaviors from them. I do a lot around network science as well, and modeling infectious diseases. And then deployment is also a core theme of my research. And so how do we actually translate the science that we're doing in our labs into actual decision support tools for public health officials? So I'm looking for around 2 to 3 PhD students to start in fall 2025. This would be combined across CPH and EECS, and I'm open to accepting students from either program. In terms of what kinds of students, definitely an interest in public health is key, especially if you're applying through CPH. Also social science, a lot of my work has to do with human behavior, beliefs, and news consumption. And so thinking about intersections of public health and social science. If you have a background in networks or graphs, as they're interchangeably called, that's awesome. Also, if you have background in applied machine learning or natural language processing or data science. So I do a lot with large scale data sets containing billions or trillions of data points. And so comfort using large data sets would also be great. Next slide, please. So one of the themes that I'm interested in is how do we leverage novel data sources in order to understand health behaviors a little better. And so behaviors are extremely critical to public health and decision making, but they're hard to observe. And I'll give you a few examples. For example, if you're thinking about the COVID pandemic or any sort of infectious disease that spreads over contact between individuals. So we need to understand this contact network between individuals. Other behaviors include vaccine uptake, right? Do people decide to get a vaccine or not? Or what happens when they're mandated to get a vaccine? And other things that you might not think of immediately when you think about health, like news consumption or social influence. And those kinds of things can shape then your beliefs and your motivations, which then lead to the behaviors that can guide outcomes, like whether you get infected or not. Next slide, please. So the challenge is that these behaviors, even as they're so important, they can be very hard to observe, either because we're not collecting the data or that data is quite private. And so a key theme of my research is how do we infer these behaviors from novel data sources, such as geolocation data from cell phones or wearables, or social media or search logs. And I've worked with all of these data sources. And some challenges that arise along with this include the data is often aggregated, the data might be unlabeled, or the data could be noisy or biased in various ways. And so how do we develop methods that are robust and can address those limitations? At the same time, also balancing privacy and utility, and also validating these inferences that we get from this data against ground truth. Next slide, please. Something I've also been quite interested in lately, and we're working on in ongoing work, is instead of inferring these behaviors from data, can we actually simulate them using something like large language models? A second theme of my research is around network science and infectious diseases. And so like I motivated, these infectious diseases, they spread over complex networks between individuals. Next slide, please. And so this creates a series of interesting network and modeling problems. For example, how do we capture heterogeneous risks? How do we fit and validate epidemiological models on limited ground truth data? And how does imperfect network data, like data with missingness, bias our parameter estimates or our downstream public health decisions? Next slide, please. And finally, I want to end with this last theme, which is deploying actual tools for public health officials. So I'm really passionate about closing this gap from science to actual deployment. For example, in past work, we deployed a reopening dashboard for the Virginia Department of Health during the COVID pandemic that allowed them to assess trade-offs between mobility and predicted infections for different regions in Virginia. And in later work, we also worked with the Virginia Department of Health to provide recommendations on where to place vaccine sites. So that in particular, they could emphasize communities that were under-vaccinated or marginalized. And so how do we use AI and develop AI tools that can help public health decision-making become more equitable and more effective? That's another guiding mission of my research. Thank you. So yeah, please reach out if you're interested in public health, and happy to take questions.
Okay, thanks, Irene, Adam, Sandhya, and Serena. That was an exactly 45-minute presentation as promised. So we'd like to wrap up by saying that pursuing a PhD is really an extraordinary opportunity. It's even though it could be challenging, it's one of the most exciting intellectual adventures that you can embark on. But it also needs a sense of purpose. And I think CPH will give you this sense of purpose. I think this is a really unique program that will offer you this unique dual campus environment with all the resources you need to move the needle in healthcare. So I think we can move to the next slide. And this is kind of just a photo of our inaugural cohort of students and faculty from last year. And we hope we can see you in next year's photo. And with that, I think we can open the floor for questions. I think we have 15 minutes to take questions that you have typed in the Q&A section. And all faculty, please feel free to step in to answer these questions. I can maybe read some of them out loud. So what exactly is verbal, quantitative, and analytical writing requirements? Bianca, do you know what the specific requirements in this year's applications would be?
So that is a 250-word document that we ask for every year. And this is really an area where students can highlight their skills. Some students choose to do it by coursework. Some have maybe a paper or a presentation they're really proud of. I just tell students, you know, whatever you feel you want to highlight that may not be obvious, as long as it falls within these skills, that is what they can do. That's what they can use to submit that. It's 250 words, so essentially it's a short paragraph.
Yeah. Another question, someone is praising Bianca. Let's skip that. Another question is, given the program is young, I assume the number of students that are accepted are fairly low. How should one stand out? As I said, demonstrate alignment with the program and demonstrate intellectual independence. If other faculty have anything else to say, well, this is like a general kind of criteria that people will be looking at, but maybe specific labs will also have specific interest in like talking to professors. This would answer like another question, reaching out to professors, talking to them, showing that you are capable to handle the research agenda that they are interested in is also like very important. Try to find aligned labs. Mention that, call that out in your research statement is also very important. Anything else anyone wants to add?
I would maybe address sort of a whole branch of questions, which is about, should you reach out to professors? Is there a direct admit approach? Are the rotations instead? How does this work exactly? So I think that whole bucket could be answered under the fact that ultimately your goal is to find a research advisor who will shepherd your PhD through the Computation Precision Health program. That could happen through a process of rotations. There are rotations within the first year. Many students find that their first rotation is a great fit. Some students find that their second rotation, perhaps even a third rotation, is a better fit, and that's sort of what they end up doing. And so I would encourage people to reach out to faculty that they're interested in, or at a bare minimum, you should have an idea of which faculty you'd be interested in. The website is a great resource for that. We hope that this webinar has been a good resource for that as well. And if you would like to specify faculty in your application, I think that will help the admissions committee understand your interests, and also for you to understand what your life at Computation Precision Health program would look like. Do you need to reach out to professors? I don't believe it is required. Bianca, I don't know if you have specific things you want to add in here, but I think different people have different approaches.
Just to say that we do highly recommend that students reach out to faculty because they should come in with a certain idea of where they would want to work. And so if they come in, you know, they need to rotate, then the program has a kind of a clear picture of where they can rotate in the first year.
Yeah. To add something.
And then maybe to add, oh, sorry, go ahead, Ahmed.
Oh, actually, Adam was the one who.
Yeah, I'll just
sorry, Adam.
It's all good. Definitely strongly encourage you to mention the faculty you're interested in working with in your application, because that it makes it more easy to search, to help them review your application as a potential match. I would say if you don't hear back from faculty during your first outreach, I wouldn't take that very poorly. Like someone that I'm working with now, I did not talk to before the admission season. It's only when I read their application in full. When the time happened, like in the December to January timeframe, is that I got to know them. And so like you should not be the bottleneck of communication. You should feel free to reach out to encourage you to do so if you don't hear back from someone at this particular time. I don't take it as the worst things in the world. Plenty of people get in despite not having the initial conversations with the faculty that they're working with. It's an opportunity to engage, but you should definitely have in mind who you want to work with because it's very helpful, both for good review processes.
There are a bunch of other questions about the specifics about direct admits, or do you sign a piece of paper with your advisor, et cetera. I would say when you agree to come to the Computational Precision Health program, you do not sign a piece of paper at that point saying, I'm definitely going to be in so-and-so's lab. Once you arrive, you can choose to do a rotation. You can choose to stick with one lab. You start to get a better feeling of what's going on there. The first year, the funding is provided some combination from the department versus the faculty who you're rotating with and or would eventually join their lab. And so that's sort of deliberately kept, to be honest, kind of opaque from the students in order to encourage research collaboration and exploration, but also ultimately finding an advisor who would then provide the funding for the rest of the students' PhD program. The process there is highly specific. It could be rotations, it could be just one and done. And I think that is also based on the students' interests and also the faculty of the CPH program. Hopefully that helps answer, I think, 5 different questions that I saw.
Thanks, Irene. There's a question about the timeline. Bianca, do you?
Yes, I saw that. So after you submit your application on December 3rd, the committee will receive all of the applications, will review everything. The students that will be invited to interview will be contacted sometime in January. You'll be interviewed, and then admission offers will go out late January, early February. For those who receive offers, we will invite students to visit sometime in March, and then you'll have until April 15th to accept your offer to then start next fall in August.
There's also a question about the SOP and the personal history statement. I think Bianca can help with that, with this question as well. Like how should they be different?
So I always tell prospective students, your statement of purpose is all about your research, where your personal history statement is to learn about you. Is right, Ahmed? Would you add anything else to that? Yeah.
If asked for an interview, will this be held in person or virtually? I think we are only doing virtual interviews. There can be like a visit for students who are selected post-interview, but I think all the interviews will be virtual.
I will say there are a lot of questions around, is this the right program for me? I'm interested in this, should I apply? I would say email me directly, biancav@berkeley.edu. We can then sit down, review your research, your interest, and really figure out if CPH is the right program, or if there's another program at Berkeley or UCSF that might be a better fit. That's something that we can discuss individually.
Yeah, and talking to faculty is a very good way to figure out whether there is an obvious lab that fits your interests or not. I know that there might be confusion with like the bioengineering and computational biology programs, but if you reach out to the faculty that best fits your research interests and talk to them, I think you will be able to figure that out as well. Yeah, so maybe we can also clarify the specific requirements regarding computational programming background. Does anyone has thoughts on that?
As we emphasize, the admissions process is quite holistic. And so we do ask for students with reasonably strong computational backgrounds that can range from things like, was a software engineer for Google and, knows how to make apps in your sleep. But also, I think we found that students from backgrounds that maybe don't emphasize as much have also been quite successful in the program as well. At a baseline, I would say you should probably have some experience with a language like Python, like R, like Java, or something like that. It's certainly, you could call it a procedural language. We would expect students to be able to implement a model with a little bit of help and not have to learn, for example, how to code from the very beginning. There's a few questions about the backgrounds. I think maybe this is a good time to pivot into that. So one question, is there an optional for working professionals to be part of the PhD program, like a sabbatical for a couple of years? And another question, I'll go ahead and batch them together. Can you elaborate on non-traditional academic paths? Is being away from academia for a while considered a disadvantage? As far as the first question, we do look for PhD students who want to do a PhD program. So if you are not able or not willing to commit full-time to a normative time of 5 years in the PhD program, this is perhaps not the best fit, although I'm sure Bianca would love to sit down with you and talk about your specific circumstances. But ultimately, if there's a working professional who wants to take a sabbatical for 5 years and do the PhD program, I think that's different than wanting to stay working or do a shorter program or something like that. And I think that's a personal choice. As far as a non-traditional path, I think we look at people's background. So what have they done with the opportunities they've been given or the interests that they've had as they've gone through their journey. And I think when people are in industry, they have different interests, they have different resources available compared to academia. Ultimately, we are interested in people who will be conducting research in a PhD program. You do not need to have a million papers behind your back. You don't necessarily even need to have a paper on your record, but I think having all of those pieces, a deep research understanding and a curiosity that aligns well with the CPH program, as well as the computational skills for the kind of research you're interested in, and or the biological expertise and or medical expertise or something else that gives us confidence that you would thrive given more time, more training, more resources.
There's a question about the DE program, and I just want to clarify that the DE program is a program that is for current PhD students. So if you are all applying for the CPH PhD, that is not something that you can take unless you are admitted to a different PhD program at Berkeley or an affiliated PhD program at UCSF, then you have the option to apply to the designated emphasis.
There are a few questions about core faculty versus affiliate faculty. So you can have an advisor who is not the core faculty, aka the people on this webinar. The AGG, as Ahmed described earlier in the webinar, that whole 60-person group is listed on our website. So we encourage you to sort of go through that list as well. So you can find an advisor who's not one of the 5 of us.
We have
There's
one
a question
more
specifically for Sandhya. Oh, so there's a question specifically for Sandhya, which I think I'll let Sandhya answer. You don't have to do it right now, but I'm sort of flagging that. And I think we're just going through these questions. Does someone want to pick a last question to end on, or if anyone wants to have a closing note?
So what I'll do is I will just find the answers to all the remaining questions and send that to everyone. So for those of you who are interested in learning more, meeting with me, talking about your interest and applying, definitely reach out to me for a one-on-one meeting. My email is included, although I think a lot of you or maybe most of you have it already. I'm happy to chat. And yeah, thank you everyone for presenting and for being here.
Thanks, everyone.
Thank you. Bye, everyone. We hope this is helpful.